Nice to see you.
Hi, Stephanie.
Okay,
Nice to see
all
you.
right. This is Scott Cravens, who's CEO of Julota. Julota,
Yes,
say it right?
that's
Okay,
right.
good. Welcome.
Thank you. Thank you.
So tell us a little bit about what you're doing. And
Sure. And first of all, Julota is actually a acronym for just love on them always. Julota is a
that.
community interoperability platform that's on a mission to eliminate siloed patient information and connect individuals to the broader care community outside of the hospital, but with the hospital.
So tell me what the problem is that you're solving.
The problem is that 10% of the population uses 60% of the healthcare resources. And so if we can just get them to the right place, the right provider, we can save over $1 trillion a year in healthcare costs nationally.
And how are you doing this?
How we're doing
Tell
it
us
is...
about it.
Yeah. So what we do is we connect individuals with case managers, with EMS, with law enforcement, with other partners in the community. We're doing a pilot project with the YMCA, with food banks, and so we're really addressing the social determinants of health. What I like to say is in the future, what you'll see is emergency departments focusing on healthcare emergencies, while EMS focuses on social determinants of health and getting people the right treatment, whether it's food for food insecurities, or addressing loneliness in the elderly with charities and faith-based organizations. So it's getting people solving healthcare within the community, which is the most cost-effective and efficient way to do it.
So are these people heavy users of the healthcare system?
They are. In fact, one of the co-founders was a 30-year ER physician, and the other co-founder was a lead architect for MapQuest and iTriage, who lost his sister to opioids. And so the two of them got together and said, we can solve this problem with one system. And that one system is to get a community around them and then automate the communication with them. So when an event happens, it flags something in the system to trigger somebody else to respond. So say a EMT goes in to treat a diabetic and they notice that there's no food in the house. So what that EMT would do is just register within the software that, hey, can a food bank respond to this individual? And so it'll alert several area food banks, plus the case manager, and then the first food bank that responds, they end up bringing in the food. And the case manager is notified to come out and make sure that food was delivered and see what other issues need to be resolved. But it automates the response.
So we only have a few more seconds, so tell me what you're up to in 2020. What are your
In 2020, the big thing is we're going to do, we're focusing on statewide rollouts as well as multi-county rollouts, because the larger the implementation, the more rapid the adoption at the local level, and the more partners that get involved. And the more partners that get involved, the more cost-effective and efficient the whole system becomes, and the more people that are helped, and that's where it gets fun and rewarding.
Where are you operating now?
We're in Colorado, Washington, New Mexico, Texas, Florida, Virginia, with more to come this year.
Great. Well, thank you very much. It was very interesting.
All right, thank you.
Okay, bye. See you.